My name's Thomas. I'm a second-year BSN student with the NSMP, the Nursing Student Mentorship Program. And today I'm here to do a musculoskeletal assessment with my peer, Sean Davids, one of the first-year students with the NSMP. And today we're going to be going through an upper body musculoskeletal injury following a fall.
Hello?
Hi, my name's Thomas. I'm one of the student nurses here today. You're Sean, correct?
That's right.
Yeah, and is that the name you usually prefer to go by?
Yes.
And what pronouns do you usually tend to use?
He and him.
He and him? Sure. I just finished chatting with your other nurse. She just signed off for the day. She said you came in because you just wanted to be checked out. You were chopping some firewood yesterday, she said.
That's right. Yeah, I was chopping firewood yesterday, most of the day, and well, I woke up quite sore today. And as I'm getting old, I thought I'd just get a checkup.
Yeah, that sounds good. Do you know how old you are?
81 this year.
81 and still chopping firewood. Wow. Yeah, but we can definitely get you checked out here.
Okay.
Okay, Sean, so we're going to get you standing up here so we can sort of see how your shoulders and your back are doing. But before we do that, we're just going to make sure that you're sort of feeling up to standing.
Okay.
So what we're going to do is have you just do a couple simple little exercises and movements, and then we'll slowly gradually work to having you standing here.
Sure.
Yeah. The first one will involve sort of you lying a bit flat, so is it okay if I put the head of the bed down?
That's fine.
Yeah. And is that comfortable for you?
Yeah, that's okay.
Excellent. And also make sure the bed as a whole is just pretty close to the floor here, just for safety. So the first thing I'm going to get you to try is if you can sort of bring your feet up towards you and then bend your knees. Excellent. And then you're sort of able to lift your hips off of the bed and hold them there for a second.
Yeah.
Yeah? How does that feel?
That's okay.
That's okay? Excellent. Are you able to come and sit on the edge of the bed here for me?
Oh, sure. I'm just getting a bit slow these days.
Yeah, don't worry about it at all.
Okay.
Awesome. Any dizziness or anything with the movement?
No.
No? Are you able to sort of lean towards me a bit? And back?
That's fine.
That's fine. Awesome. And how about your legs? Are you able to straighten one at a time for me? Excellent. Excellent. Still good?
Yes.
Yeah? Okay, then we can take it slow, but we can have you stand up now. And we got your non-slip footwear on, so you're all good to go. I see you really prefer that left side there.
Yeah.
Is the right side more tender?
Yeah, it's a little sore.
Yeah? And was that just from this morning?
That's right.
Yeah? Okay. Are you feeling dizzy at all after standing?
No.
No? Okay. So if you could face me here, I'm just going to get you to see if you can sort of mirror what I'm doing.
Mm-hmm.
So you're able to raise your arms up ahead of you like this? Okay, so the right one is quite a bit more sore.
Mm-hmm.
Okay, you can relax them. And I'll just throw on some gloves here and I'll see if I can sort of assist to get more range out of it.
Okay.
Yeah? So how come you had to spend the whole day chopping wood?
Well, it's just me out at the cabin these days. My wife died a few years ago.
Oh, I'm sorry to hear that.
Winter's coming. Gotta get ready.
Yeah? And it's just you? You don't have any grandkids or anything who can come and visit?
No, it's just me and my dog.
Oh, okay. What's your dog's name?
Spot.
Oh, Spot. That's nice.
Yeah, he keeps me alive, I tell ya.
Yeah, they're super supportive, aren't they?
Yeah.
So you're able to raise your arms up ahead of you again here. Just as far as you can go without it hurting. And I'll just come around here. And do you mind if I sort of assist, see if we can raise it up?
Yeah,
Let me know if it hurts at all.
about there.
Right about here? Okay.
And this one I can go all the way.
Oh, excellent. And then do you want to bring them just back down by your sides here? And then we'll do the same, coming out to the side. Awesome, and I'll see if I can just get this one up a bit as well. And right about there.
That's right.
Yeah, okay. And down, and then we'll see if we can get them to go behind you, sort of like this. Right there? Okay. Yeah, so that right one definitely. And is the pain, the soreness, is it more in the back here or more sort of on the front?
It's kind of around the back a little bit. Just
Okay.
inside my shoulder blade.
Okay. Well, if it's all right with you, I'll come around and just sort of see how everything's looking.
Okay,
Do you mind if I undo your gown here?
that's okay.
Oh, that's a nice tattoo you've got, Sean.
Oh, thanks.
So we're just going to take a look at your shoulders. They're symmetrical and even, which is great. Your spine is midline. And have you been having any back pain
Nope.
since yesterday? No?
No.
Okay. Then I'll get you to sort of bring your shoulder blades together like you're sort of squishing my hand. How does that feel?
Little pain on the right.
Yeah, it looks a little bunched up there. But there's no protrusions. They feel warm. There's no pain when I'm pressing here?
Nope.
No? Excellent. How about on this side? Is it tender? Right there?
Yeah, it's tender right there.
Okay. And then one last thing that we'll try is I'll get you to sort of bring your arms up in the T position again, and I'll just see how your shoulder blades are doing. Okay, yeah, so definitely this right one is having a bit more of a struggle there. And then there's one last thing I wanted to check. I'll come around in front of you again here. And we're just going to see how your hands are doing, just to see if there's still some good grip in those hands of yours. So if you could just reach your hands out and sort of squeeze my fingers here. Okay, so there's definitely more strength in this one here. And then one last thing, can you push up on my hands here? Awesome, and push down. Okay. So yeah, we'll get you back into bed here in a second and we can take a look at your shoulder and I'll go and chat with the doctor and we can sort of see what's going on and what we can do for you.
That sounds great.
Yeah, I'll be right back.
Okay.
For this assessment, we performed a musculoskeletal focus assessment on our patient Sean. He came into the hospital after spending a day chopping firewood, complaining of tenderness and stiffness to his shoulders. So before we actually got him up and out of bed to test his range of motion, we had him do a freestanding safety check to make sure that he wasn't a fall risk. He passed with flying colors, so we got on some non-slip footwear and had him stand. We then proceeded to test both his active range of motion and his passive range of motion. Active refers to what the patient is able to do on their own, and passive is how far they are able to go assisted by another person. We noted that his right shoulder and his right arm overall were weaker. There was more stiffness and decreased range of motion. Upon inspection, we noticed that his shoulders, there was tenderness to his right shoulder. However, there was no inflammation, there was no protrusions, there was nothing that indicated any kind of severe injury. And a good thing to keep in mind when working with patients, especially older patients or people who might not speak English as their first language, that communicating about pain might be a little more difficult. And older patients especially usually try and act a bit more stoic around the care staff, and they may not be as open to telling you that, oh yes, this is very painful. So paying attention to body cues like facial grimacing and the sort of twinges you noticed as we were palpating are important, as they can give you a better idea of what pain your patient is actually experiencing and what is exacerbating it. So following this, I would consult with the doctor and the nursing staff, and we'd document about the patient, about what he came in for and what our findings were. And we would come back to follow up with the patient afterwards to see if they needed any other assessments done.